Welcome everybody to the second breathing clinic. This is session two. Session two is normally like the continuation of what we didn't finish from the first session, which is mainly the Buteyko breathing method, learning how to restore nose breathing, nasal breathing, proper volume and breath. And just a little bit more about that is you want to make sure that when you're doing nasal breathing practice, that your tongue is up in the roof of the mouth, your teeth are either slightly separated or gently meeting, really lightly meeting, and that you're stacked up. So we're gonna be doing a lot on posture, but that's the starting position. So if you're not in that position, I'd love for you to plant your feet, make your feet flat, don't crisscross your legs. And what I'd like to see is that you're not hunched over, okay? I'm going to share a screen, and I was explaining to Dr. Harvey, it's a little different when I teach dentists this. You know, as I teach patients this, we go around and practice together, and it's slightly different because you all are just more, you know, trying to learn what I do and what the exercises are. But when I'm doing this in a actual patient setting, we kind of go through exercises together. Okay, so we had ended on breathing volume, reduced breathing exercises. So if you can remember, we did a few where we were putting our finger under our nose, keeping our mouths closed, and gently breathing in and exhaling so light that you almost can't feel it on your finger. That was one. And you practice that for 5 minutes to try to really sense the volume that you're trying to feel on your finger, and actually reduce that volume so that our bodies aren't used to big breathing. You know, big breathing, sleep apnea is a big breathing diagnosis. People don't realize that, but they're used to huffing and puffing all day. So we want to eliminate that and start to reverse that. So addressing breathing should be very natural. It should be forced, and you want to encourage slow breathing. It is something that you can reduce through mental commands and actually encourage through relaxation. A lot of people will do mindful, you know, meditation, things like that. Those are all forms of slowing down our breath. But we want to be aware that the volume is what we're trying to reduce. I'm going to keep going here. So what's the effect of stress on breathing? And this is really, you know, a lot of us are under a lot of stress, and we don't, maybe we're just so used to it that our bodies are adapted to it. But fight or flight, sympathetic nervous system activation, some of us are living in it. Some of us are, you know, that's the system that we live in. And what we want to do is really not be in that system all the time, and be able to change it. But why does stress, what does stress do? It makes us ready to move, we're ready to fight, we're ready to flee. Our breathing increases, our heart rate increases, the adrenaline starts pumping into our blood. But guess what? We stand still, or we sit still in the computer, and we're frustrated, and we're gritting our teeth. But all of that is internalized. All of that is, and guess what? It changes is how we breathe. We end up breathing very quickly. So this is a very good trick for people that are stressed out, and that have anxiety attacks, even people that have, you know, coughing attacks, asthma attacks, any kind of attack to the throat where you feel like you're choking, or like you can't get the air to be a natural, gentle breath. So this, I will tell you, actually works. And one of my patients, I used this once this past year and once the year before. And my patient, we do a lot of dry needling in our clinic where we try to eliminate trigger points. It hurts, right? So it's a painful thing. Sometimes the muscle twitches and it really is painful. for that moment. Well, this person that I did it on, I used this technique because she went into a panic attack. Her, her eyes were starting to roll back. She was, and her mom was there, holding her hand. They were both very nervous. So as they hyperventilate, right? Panic attacks give you hyperventilation. And what I want you to do is imagine that your patient is going through a panic attack. What we need to do is slowly close their mouth and have them stop breathing for three seconds, and then let them pant away, let them, experience their breathing, how it is, and then have them close their mouth for 3 seconds, hold their breath, then 10 seconds. So if you want to practice this, all you have to do, and I normally put my timer out, my stopwatch. So I will tell you when to not breathe. It's 3 to 5 seconds for every 10 seconds they breathe. So, and the 3 to 5 seconds, what you want to do, you will transition to 5 seconds once they are starting to come around. So gently breathe. You're going to normally gently breathe. And what I'll tell you when to hold your breath. Ready, get ready to hold your breath, and hold your breath. 1, 1,000, 2, 1,000, 3, 1,000, breathe. Now they might be panting. That's okay. 10 seconds of it. I let them do whatever they need to. And I say, okay, ready? Stop breathing now. 1, 1,000, 2, 1,000, 3, 1,000, breathe. Let them, deal with how they're breathing. Get ready to stop breathing now. And 1, 1,000, 2, 1,000, 3, 1,000, breathe. 10 seconds of breathing, however, and then if I can get them to shut their mouths, and I say they're coming back, okay, close your mouth and breathe through your nose. Ready, get ready to stop breathing. 1, 1,000, 2, 1,000, 3, 1,000, breathe. So just know that the reason why I really do think this type of breathing practice or exercise really turns them around is that they're not blowing off that CO2 that's making them lightheaded, that's making them actually not get enough oxygen to their brain. So you want to make sure that that what they can do is hold their breath for 3 seconds. It took about 2 minutes for her to come around. Then I went to 5 seconds. In a matter of 3-4 minutes, they were back. And then you just continuously try to make sure that they just nose breathe. All right, so now let me share again. So the next exercise is really, if you have no heart condition, if you're not pregnant, if you have no history of stroke, this exercise gets you to a place of really a good controlling your volume. I think I'm going to mute everybody. Okay, it controls your volume, this holding your breath while you walk. So I'm going to, if you want to do this with me, you're more than welcome to. I'm going to stand up, and all you have to do is you're standing up because out and about, not right now, it's so easy because there's snow on the ground, but you're going to take a walk, right? You're walking in a good stride. I normally walk pretty fast. And what you want to do is this is called steps because you're going to walk with this. It's kind of like the exercise you did with your plugging your nose and holding as long as you can, but now you're walking. And CO2 is made in the muscles. So you're going to actually be holding your breath and making more CO2 in the muscles and holding your breath and retaining it. So what you want to do is hold your breath and walk as many steps as possible. After you exhale, you count those steps. How many steps can you walk before you need to breathe? Okay, so here I'm walking. I have gently breathe in and gently breathe out. Gently breathe in and gently breathe out. Last one, you're going to gently breathe in. Let everything gently out. I plug my nose. I count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. I'm counting in my mind. And when I need to breathe, I unplug, and it's like, it's big breathing for, you're allowed 3 big breaths, 3 big breaths, and then you're back to a normal breath. So you want to make sure you understand that, what are we trying to do? We're trying to improve our tolerance to holding our breath. That's the way that our bodies get used to having CO2 more in our bodies than blowing it all off with big breathing or mouth breathing or over breathing, we call it, when we breathe too much. We actually need an air diet. This is the course of an air diet. Just like people eat too much, well, people breathe too much. And that conditions you to this big volume breath, which will only put a lot more pressure on your heart. If anybody has high blood pressure, that it's not good for your other systems in your body. So these are just pictures of the breathing exercises that I do whenever we're back into the clinic with groups. Right now we can't do that. So the goal, just so you know, I've only gotten to 75 once. When I started, I was at like 18 steps. So breathe in, breathe out, plug your nose, count your steps. I started at 20. So remember that first measurement that we did last week, where we breathed in and out, we plugged our nose, and we counted how many seconds we could hold it before we felt a neck jerk or a tummy jerk. That was your control pause. That what this means, a control pause. So if anyone had a control pause anywhere that was 20 seconds or below, you would be at about 40 to 60 steps, right? So right now, my CP is about a 32, and I'm in my 60s normally, but I've gotten to 75 once. That's how many steps you need to take before you need to breathe. So this is a good measurement of how well you're doing. Okay, so we're going to keep going so that we can go into the second session. So what's a good program for adults? Okay, so once you wake up out of bed, you actually want to take your CP. That measurement tells you how well you've been sleeping all night. You know, if you're a mouth breather and you don't tape and you don't use a breathe right strip or a nasal dilator, I bet you'll probably be under 20. If you slow down your breathing right before bed and you tape and you clean your nose and you use a nasal dilator, you will probably start improving that number. You want to go on a walk with your mouth closed the whole time if you can. Try to get your steps in. Every day I'm trying to get 10,000 steps in a day, and it's important that we don't get used to not moving. Within those steps, if you take a walk, try to do these step repetitions. That's the Mac Daddy of all these exercises to improve your volume, is the steps. If you're already exercising on a treadmill or taking a walk every day, spend 10-15 minutes working on your breathing volume. Okay, and then if you work out at the gym, I mentioned work out with your mouth closed. Really focus on keeping your mouth shut.
Hey, Leslie, this is Dr. Michelle again. I promise I won't call you anymore today. I promise. So I just wanted to make you aware.
There we go. Okay. All right. So let me just keep going here. I hope everybody's taping. I hope that you're taping, because taping is a pretty simple thing to do. You can use the Somnifix. You can use the 3M Micropore. You can use this myo tape that I mentioned last time that wraps around your lips. A lot of people are scared to tape. This myo tape is like, for me, I think if I were a first-time user, I'd want to use this just so that I'm for sure, not going to suffocate or anything. But this is in the link of the supply list that I've provided. And if you need the supply list again, I can always send that. These are all the nasal dilators that we talked about. This breathe right is the easiest for people to handle. Some people don't like things in their nose. This and this, the nasal aid and the mute, a lot of people do like it. I end up using the mute when I bike. Biking is big volume and you end up getting a little congested. Anytime you have big volume, your nose kind of plugs. So if I can keep my nose open while I'm biking and keep my mouth shut, even if I'm wearing a mask, it's helpful. If you're a runner, I would say the turbine is also a nasal dilator. The turbine is supposedly an upright nasal dilator compared to the mute, which is more horizontal. I think it's just a little bit of marketing. Remember, if you are going to use a nasal aid, I use a little tiny bit of tape right here at the top, just to keep it in place. Remember to try to use sea salt rinses, clean your nose. I like to inhale. Remember, I showed you, let me just stop for a second. If you all aren't cleaning your nose, it's important that you try to understand the whole purpose is we've got to use our nose. The nose is underused. We don't realize that we mouth breathe. Even if your mouth is slightly open, you're probably using it. So if you don't use your nose, it gets congested and just gunky, and it won't allow, it'll make any resistance to breathing. You're going to want to mouth breathe. So remember to use this where you inhale. This is just a quick review. You inhale, I swallow. It's just a way of cleaning the back side of your nose. The back side of your nose is an area that gets really mucousy. And we anytime you're a little mucousy, you're going to stop using your nose. So we're going to keep going. Okay. Yeah. So, and as long as you can nasal breathe for 1 minute, I'm going to go back one. If you can nasal breathe for 1 minute with your mouth closed, if you're a mouth breather, it's not structural, it's habitual. You can, if you can't nasal breathe for a minute, I would say go straight to the ENT just to get a scan and check to see if there's any deviated septum or any blockage of any kind. Okay, so now we're going to go into the second session is the myofunctional therapy exercises. That's for airway health and posture in general of the spine. Next week after that will be more of the neurological exercises to restore the autonomic cranial nervous system. And I will stop here. Okay. And we're going to go to, hold on 1 second. Session 2. Okay, so session 2, once we can get you there. Okay, so session 2, what we're going to do in session 2, we're going to talk about the head and neck posture. We're going to talk about oral posture. What is oral posture? A lot of people don't realize that there's a way to hold your mouth. With the best way is to help support the back of your throat from collapsing. And you want to be able to breathe in this posture. So this is just in general, the natural curves of the body. And think about the way if you're sitting with this curve, or are you slumped right now? The weight of your head gets distributed differently if you're slumped. So let's take a look at that. Every inch you go forward creates more of a lever arm here. So you're going to create even more load when your head is, for example, 3 inches forward is about 42 extra or 30 extra pounds compared to what the weight of the head should be directly over all the natural curves of the body. So if you want to notice how much extra load you're putting through your spine when you're slouching. One other thing you want to note is the airway position. A lot of people don't realize that everything's in front. These Zoom meetings are in front. If you were to look at me, I'm going to pause this for a second. And if I'm here like that, okay, so I would correct people's necks, right? I'm a physical therapist that uses my hands, manual therapy to get the head from here back. But so many people would fall forward again. Right when I'd let go, they'd go back. And why is that? Well, the airway is shaped in a way just like we do CPR, right? We do CPR when we find somebody, we extend their neck to open the airway. So what is this posture? That's an open airway posture. So the body is trying to find a way to breathe, and that's why people get into this head forward posture where their head is rotated posteriorly and their head's forward. So if you don't, I'm gonna go back to the presentation. If I were just to correct this and realign them, and they had a Malampati score of say 3 or 4, they're going to bounce right back here. What creates that stable airway is the tongue resting in the proper position so that the soft palate isn't falling down. So we're gonna do some exercises, and hopefully you will join me to do them. This is actually a picture of my daughter when she was 4. She's 12 now, but I found this article was a typical airway breathing, mouth breathing child in Italy. That this picture just was like, oh my gosh. So what happens to children when they are very weak and mouth breathing, and they're, like this is a very typical presentation where the jaw set back, she's got winging in her shoulders, her belly's distended, she's rounded in the shoulders, she's slumped with the head posture going forward. That is very typical these days, and how you develop as a child becomes an adult with that same problem. We've been doing a lot of myofunctional therapy on her and breathing training, and she's a swimmer, so things have changed in her life for the better. So here's some imagery around the airway. So a lot of people think the nose is just this little bit. And this is just the tip of the nose. This is this huge, sophisticated system for breathing. And guess what? A lot of people stop using it, and then they only use their mouth, and the air goes here. And this is where the soft palate starts to fall back. And then if they're a low tongue posture patient, mouth breathing patient, low tongue posture, the tongue actually gets pretty lazy and weak. It gets weak and it gets a little fat even too. So what we want to do is kind of keep creating that tongue posture up behind the front teeth. I always tell people to say N, and you'll feel the tongue go right to the right spot. This in myofunctional therapy is called the spot. But not only do we want the front third to be up, we want the back of the tongue up, so that this is helping lift this up, and that it's creating a position where you can hold your head back and that you don't have to pop forward to be able to breathe. And this is just like the front of your airway without your face on it, your nose, your little dangling uvula. I show this to people just to show them the areas of openings that the airway has behind the face. Now, when I look at patients, I always want to see, can I see under their uvula? Right? I want to make sure that this area here, I can see an airway. It's not just a wall of soft palate. Those Malampati 3 or 4s need a lot of tongue training and breathing training. So if you see somebody where it's just soft palate in the back of their throat, they are someone that is probably really tired, probably snoring, and maybe even has some sleep apnea issues. Okay, so let's start by activating the soft palate muscles. Right? These are all little muscles that help lift the soft palate. Okay, so what I want you to try, you're all on mute, so no one hears you. These are sounds that raise and lower the soft palate. Okay, so as you do these, a lot of my patients will have a mirror next to them and a flashlight, and they will be looking at their soft palate move. So you want to say, caw, caw, caw. So that sound, and I'm going to go on, let me just stop share for a second. There's 4 sounds that I'm going to go through. So in my mouth, you want to, you can kind of see the back of my throat. It's not that easy to see, but caw, caw. And then you say ark, unk, and think of hollowing your throat. Ark, unk, ark. And I think I'm trying to raise and lower my soft palate. If I say g, g, the back of the tongue gets really weak on patients. So the back of the tongue, if you can have them lift and lower, g, g. And then hawk, the sound hawk. And I always say, hollow your throat, create that airway and open it up. So those are sounds that you want to try to, if you have a Malampati 3 or 4, you want to be doing these. I do them just to prevent any collapse of the back of my throat. Okay, so, and listen, myofunctional therapy is, it's much more than this slide. Okay, so there's very, very skilled myofunctional therapists that work with children and adults that have swallowing, tongue thrust swallow, or, you know, mouth breathing, or just they're clenched all the time. The clenchers need tongue training. You know, they need to learn how to rest their face without that tension. So let's go through and do tongue point and trace. These are my favorite airway exercises. So just know that there's more to this, but these are the ones that I find, if you're only going to do a few, might as well do the ones that I think work the best. So tongue point is your tongue. Try to get as narrow as you can and point you like this. So I will look at the side view. If you put it out and point it, it draws in. You know, remember these tongues are kind of fat, so you want to work the tongue, get it in, then put it on the spot, and then on the spot, draw a line all the way back to your uvula. So you're touching the back of your throat, the soft palate, and you try to open that area. This exercise is called tongue point and trace. Tongue point, up on the spot. Now in your mouth right now, keep it on the spot and draw it all the way back. And hold it there, hold it there, hold it there. So all this should be tight on you right here. Now I like to combine my, it's called waggle. These exercises are really goofy, and they come, there's a little kit that I have patients get, that it's a little kit of all these little gadgets that they use for their lips and their tongue and their mouth. But the waggle, you want to make sure that your tongue disassociates from your jaw, that your tongue isn't just dragging your jaw around. So if you, I tend to have patients kind of hold their jaw, stick out their tongue. So notice my jaw's not shifting. If I was tongue-tied, my jaw might shift with me, right? So you want to make sure that the tongue moves independent of the jaw. So tongue point, right, left, up on the spot, draw a line all the way back. So that one is great. If you're going to do one, that combines a lot. The cave, a lot of you might be doing this check if you're checking for lingual ankyloglossia, if tongue tie issues. The cave is a way that you can see that frenulum really easily, where you have them suck their tongue to the palate, And I have them start with 5 seconds. Some people can't even do 5 seconds. Some people can't even create a suction, but you want to work on holding it longer and longer. So this looks like this. So your tongue is in the sing end. And I'm creating a seal, and I'm stretching the undersurface of my tongue. So if you find that someone cannot suction at all, like they're doing weird things with their mouth, you know that their tongue isn't resting up. Their tongue is probably low in their mouth. The low tongue posture patients are my clenchers. Okay, so we want to try to restore proper oral posture. All right, let's keep going. These exercises I do, the arc unkanga, I will do some sort of sounds in the morning when I brush and then in the night when I brush. I'm lucky to teach these exercises all day, my airway exercises, because the majority of people have airway problems, and they are being taught in my practice all day. So if you are someone that has a Mallampati score of 3 or 4, there's another exercise called the pharyngeal muscle activation exercise, where you do a cave, you suction up like this, and you resist opening, and you create with a little cradle of your pincer like grip, your thumb and your index finger right at your hyoid, at your larynx. You want to resist with your tongue suctioned up, so you can imagine your tongue is forward in your mouth. And all I'm doing is putting 3 seconds of pressure on my larynx and 3 seconds of pressure on the other side. So I alternate right and left. And you do this if you have a Mallampati score that's 3 or 4. So again, it looks like this. So just like an isometric means that you're not, if this is an isometric of my hand, like I'm not moving anything, but I'm creating resistance. So these pharyngeal muscles, you can activate them, and if you can activate them, it will create more patency in your airway. So you're here, tongue up. So I'll watch a movie and I'll do 10 on each side, you know, just to create that little bit of activation of those pharyngeal muscles. Okay, so let's keep going. Another exercise, a little modification of this one, is the pharyngeal muscle activation when you say ah. So you want to create that sound and hollow your throat. So you're ah, like that, like you make a nice sounding ah. And with the same grip, you're going to be right at the index and the thumb at your larynx. Let me just show you this in the full screen. Hang on. So this one, so I learned all these exercises at an airway conference by one of the presentation was my colleague Greg Johnson, who has a whole program on airway. And if you can, if your voice sounds like it's crackling, that area, you want to really work the vocal cords there. But it's the same grip, hollow throat, and I oscillate a little bit at that. I do 3 seconds and I oscillate. Again, this is if you have a Mallampati score that's, you know, 3 or 4, that you can't see your airway well, and you want to create more space there. All these muscles, you know, that we're working will help open that space up. Ultimately, we do need the tongue lifted, supporting that airway shape. The airway shape changes when the tongue stays low in the mouth. Okay, let's keep going. Now, a lot of us that have issues with TMJ, want exercises that relax your face. And tongue up, open, close is something I teach all my patients. So tongue tip up in the end position, and you're going to open and close. Just like that, tongue up, open, close. And it's almost like you're lubricating. It's a hinge joint. You want to make sure that the synovial fluid goes between the surface of the condyle of the mandible and the articular surface of the temporal bone. And, you know, clenchers, they are jammed up in there. There's not good flow of that synovial fluid. So that every 2 hours, if I have a patient stop what they're doing, put their tongue up, open, close, it will help kind of flush those nutrients through the joint. One other way to do it is adding a little resistance under the chin. If you resist the elevator muscle, the closing muscles, the opening muscles, it'll inhibit the elevator muscle. So if you do the same exercise, tongue up, open, close, and then you put your thumb here and hold for 2 seconds as you open, you cannot clench and open at the same time. So it inhibits those muscles that want to clench. So that exercise really works when you do it throughout the day. You know, some people put a timer on their phone that says, oh, do your tongue up, open, close exercises, so that you're aware, is my tongue up? Am I clenched? It's a good practice to reduce tension. Okay, so there's a program that I do for children, but you know, adults or children that never learn certain proper habits of you know, breathing and chewing and swallowing. So good oral habits are good oral posture exercises is called the goalpecs. And for anybody that works with children, it's hard to get them in the clinic. You know, I probably have 5 kids right now that I'm working with that the parents send me a video through the app, and it's a way for me to critique the exercise and give them a star, up to 1 to 5 stars. So it has been a great way to work with children that are mouth breathers, that are tongue thrust swallow, you know, kids, and they can do it from home, and it actually does really work. So a couple ways to find this good oral posture. You can do the click, click, close position, where you cluck, you cluck, you close. The idea is to understand that your tongue suctions the roof of your mouth, and that's where it should be. We talked about the N close position. So you say N and then you close, right? And then in that N close position, one exercise is, as you sit there, you should have your tongue in the roof of your mouth. Push your tongue up. Hold it for 3 seconds and then gently reduce the tension. And then push it again. And relax. Push it again. They've done lots of studies on mouth breathers that their tongues are very weak. And that pressure against the palate, the hard palate, that's really what grows their mid-face forward. These kids are all kind of, I call them kind of bulldogs, right? Their noses are kind of stuffed into their face. You want that mid-face growth to happen, and it happens because the tongue is pressing forward, and as they live and chew and swallow properly, their faces grow right. So this is the chewing and swallowing exercise. Who thought you'd ever have to learn how to chew and swallow correctly? Well, what I have found in my adult population is that people eat sloppy. And sloppy eaters all swallow sloppy. So what you want to do is sit in good posture, get your feet planted, chew your food until the chewing of the food becomes like soupy, mushy. Gather that food into a ball or a bolus, you know, they call it the bolus, put it in the middle of your tongue. You go into that proper oral posture, you pause for 2 seconds. Sit straight up and you pause for 2 seconds. And then you swallow with all the muscles inside your mouth, not the grimacing muscles. So if I want to show you real quick what that looks like, I'm going to stop share. So if I chew, pause, and I pause and I have the food right in the middle of my tongue, and I point. This is 1,000, 2, 1,000, and then I point. I want you to see my throat. You shouldn't see anything here. I don't want to see. A lot of kids swallow like that, and adults. So that creates eventually a TMJ problem. Or the craning, when they swallow, they, you know, I have a lot of older population also that choke on food. That's all swallowing improperly. So you, just like PT, you know, for the knee, there's PT for the throat. And that's what we do in our practice. So you want to, I'm going to gather a little spit, put it in the middle of my tongue, watch my throat. It's just a little gugunk. And I rate these kids, and I will not give them a 5-star until they properly swallow without any tension in their face and proper posture. And some of these kids have never sat in proper posture. So it's been an eye-opening experience to work with this program. Okay. So this is, you want to pause for 1 to 2 seconds and allow the muscles in the throat. There should be no movement on outside the face. It should all be in the throat. This is another exercise called counting. This has been if I were, you know, someone that comes in that's a mouth breather that doesn't understand oral posture at all, this is the exercise that gets them sitting perfectly. Again, a lot of people don't ever feel this all day. When you don't feel this all day, you don't think that is a normal position. Your brain doesn't think that's normal. It thinks slouching is normal. So you use a mirror, you look at the mirror, and I will pretend I'm a child doing it for me. And the parents always film for about 10 seconds posturally. I want to see the side view, and then they come around and film underneath their face so I can see how much tension's in the face. So I will count to 6 just to show you, you only breathe at the 5, the 10, the 15, the 20. This is a way for you to control breathing. It slows it down, and it practices spinal posture and then oral posture. Oral posture being tongue up, teeth lightly meeting. If you're a TMJ patient, slightly apart. Lips are together but without tension. So I say no creases, no wrinkles, no nothing here. So it looks like this. 1, 2, 3, 4, 5, 6. And you will, it seems so silly, right? But people that have tension in their face, it is the hardest exercise for them. And I say you have to look in the mirror because you have to see that you have tension here. You've got to not go to the next number until you relax your face with your tongue resting up. So that is a great exercise for people that have a lot of tension in their face with lip seal. And lastly, there's a reading exercise. So reading, you know, people talk and they mouth breathe while they talk, especially the talkers, right? The ones that talk all day and they talk, then they suck in their air through their mouth and they talk more. So those are big breathing volume patients. And they might be children, they might be adults. So basically you're going to read a sentence and then pause with your mouth in the proper position, and you breathe at the periods. In any comma, you're going to pause and either breathe if you need it or just pause with your mouth closed. Too many of us ramble on and we're sucking in, blowing out air. So this is just 3 very simple exercise is the breathing, the Goalpecs program. Okay, so what are the exercises to improve posture and reduce muscle tension in the upper quarter? I teach many dentists this because a lot of dentists have neck problems. You know, if you're a surgeon, you're looking into a small area, your head has to sometimes go into different positions. If you're a dentist that always looks at their patients on one side of the patient, you know, you're always rotating. I find that many of my dentists have a left rotation of their atlas. So that left rotation sometimes will create an uneven bite as the mandible adapts to that upper cervical position, just because of the proximity of the TMJ, the TMJ and the jawbone to the first vertebra. This is the first vertebra, and this is the TMJ. So that's the transverse process of atlas and the TMJ. So if it's rotated, it's going to shift that bone a little bit. Okay, so sitting posture, you want to sit with your sternum lifted. One way to check if you're in the right posture is your malar bone, your cheekbone. When you go under your cheekbone and go straight down, do you hit your sternum? If you are in a forward head posture and you're here and you're under your malar bone and you go down and you're in air, you're not in good posture. You're going to have an inverted cervical spine. So you also want to always have a lower back lordosis. So feel your back. Are you hunched right now? Are you rounded back? Are you, you know, you do not want to hunch your lower back because your head will go forward. You can't control your head posture if your back is not in that lordosis. Try not to cross your legs. Try not to lean on your elbows. Try not to lean on your jawbone. All of that is really bad for your TMJ. This, if you have a foam roll, this is the exercise for upper back hunching. And this is an exercise that, if you can imagine, this is just a $30 foam roll. We have one. I have one up in my room and one on the first floor, and I roll and watch a movie, and I'm just trying to unwind my body because I'm just like you all. I am in the mouths of people. I'm on the head of people. I'm hunched over, so I have to cross train my body so I don't get stiff forward. So your knees are bent. You're going to backward bend. I have them do 3 and then scoot down 1 little inch. So each little vertebra you're extending. Why? Because we tend to hunch here. That's a flex position when you hunch. So you want to get those joints to glide and to move. So as they go down, they end up having their head slip off of it. The base of their skull has a lot of tension. That's where a lot of headaches start, right there, because your head's forward, and that tension right around the great occipital nerve and the suboccipital nerve. You want to release the tension there. So they'll roll their head back and forth. They'll also do chin tuck exercises to open up the base of their skull. They might also, if they're appropriate to do it, do lifts, kind of like a sit-up, but for the neck. A strong front of your neck is just like a strong lower belly. You know, you want your abdominals to be strong so you don't strain your back easily. Same thing. If these neck muscles, see how she's lifting her head here? If those muscles are weak, and many people, as they sit and they work and their head's like this, these muscles are hanging out. They're not doing much. Back here will be tight because it's holding the weight of the head. That weight of the head, if you stack your bones are what support weight. If your head starts to tip forward in front of that center of gravity, the muscles have to hold the weight of the head up. So it creates a lot of trigger points and a lot of eventually headaches. Okay, so we're almost done here. I love these. These are called my snow angels. I'll have people go up and around, and it really will, it'll identify how tight you are in your chest. Some people cannot touch the floor, you know, that their hands are so tight, that their chest is so tight that they can't extend their fingertips to the floor. This is another very important, easy one to do, is doorway stretch. You get into the hold up position like you're being held up by a police. 1 foot forward, 1 foot back. You lean forward, and then you rotate one way just to open up that space. And then you rotate the other way to open up the opposite shoulder. And you're also doing a calf stretch. So calf stretching is very important too. I think calf stretching is something that everybody should be doing. These are just options to open up the chest. So I like using these straps. This area, I will tell you, if you don't stretch your chest and your muscles here are so tight, this will happen. And then guess what? Can your head go back? Can your head be neutral? No, it can't. So I want you to know that if you're rounded, you're just stuck here. You can't get back. So you need to stretch this back so that your head can be neutral. Okay? And also when you're rounded like this is far. I'm going to show you how far my shoulder will extend or raise. So I'm here, I'm slouched, my shoulders are rounded. Here, that's the limited spot, right? That's all I can do. But if I'm here, my shoulder can go farther back. Your whole body is adapting to how you kind of hang your body. You need to know that alignment, the curves of the natural curves of the body are what's going to keep your body healthy. And we're head and neck practitioners. You're stuck looking in a small space. You're going to be going forward, so you have to do cross train, right? Do these extras. I'm not giving you a ton. These are simple. They're like stretch this, right? We're going to do one more in here, and really those two areas get you straight. If you can stretch this and know that if you're not stretching it, you need to, because we're always using our hands this way, and you've got tools that you're always doing this, right? So this is going to be tight, limiting how good you can align your neck. Okay, this is a critical exercise. Now, right now, you might not want to get up and do this, but if you find a corner and you can put your hands behind your head, pretend your hands are a wall. Put your base of your skull into your palm of your hands like this. Tuck your chin in. Tuck your chin in. Tuck your chin in like this. So I know it doesn't look very attractive, but the base of your skull, when you do that, you open it up. So you don't want to get stuck with a tight base of skull. My older patients, my Medicare patients, are stuck like this. I get them against the wall and they can't even touch the wall because they're so stuck. You want the ability of your upper cervical spine to move. You don't want to get stuck in a state of immobilization right here. Remember that malar bone sternal alignment will create that nice curve of the spine up there. This is not how I want you walking around, but I do want you stretching it a little bit throughout the day. What people don't know is that forward head postures pull the jaw back. Why? Because the length of the space between the chin and the sternum, these are the supra and the infrahyoid muscles. What is longer? What's a longer position here? If I do that, this length, what's longer, that or this? Obviously this one. So muscles that are connected, this is a fixed point. So the moving point is the mandible. The jaw's going to get pulled back just because of physics. Okay, so you have to understand occlusion starts to change depending on head position. Okay, quick, if you want a quick exercise to just reduce tension. I do a lot of telehealth now and my neck is starting to just drive me nuts. But every patient, I will do 4 shoulder rolls back. That moves my upper thoracic spine. I keep that length. I spin and look behind me. I spin like pretending that my head is on a stake and I'm just spinning. Even if I just do that, it takes about 10 seconds and you're good. I'm here rather than here. Okay, so shoulder rolls quick, rotation. If you wanted to do 2, it'd take 5 seconds. Now, if you had a little more time, you can put your hand behind your back and stretch out that upper trap. That upper trap gets really tight. Chin up, chin middle, and chin down. There's different fibers of the upper trap. You can play with the position of your head. And then squeeze your shoulder blades together a little bit. That's your rhomboids. Those are the muscles that pull your shoulder blades in so that you're not just kind of winging out. Last one for posture is the chicken wing reset. I like this one because right before a walk, I will do this. You'll notice that I'm kind of pinching my armpits here. My elbows are high in a line, but I'm not like that. I want to try to bring my shoulder girdle up and over. I'm here, and I breathe in, tongue up, breathe out, face relaxed, breathe in, breathe out, lower, and then hands down. And I'm in that position where my spine is in that. So you just know that if your body is used to just slouching all the time, your brain thinks that's okay and normal. You have to insert these proper positions, or else you'll end up with a bad neck. And if that's okay with you, okay. But pain is not a nice thing. And that's really what brings a lot of my adult patients into my practice, is pain. So, alongside with this is exercising your core. These are some exercises, very simple planks that are important for you to use. This is another reminder of using tape. And sleep postures. Like sleep postures, I hope no one's sleeping on their tummies. That really twists your upper cervical spine. Anytime you do that over time, your joints might get stuck in that position. I like to use a little bit of a pillow between my knees. I like to hug a pillow, and I use a medium-sized pillow up in my neck so my neck is straight. My spine is straight. Notice that I'm taped. Good practice is not to look at the TV too late at night. An hour before bed, you should turn off all electronics, all screens. Do I always do that? No, but it's not good to be, in these screens all day. This is a position that I was in after my nasal septum surgery. There's a little wedge here. So wedging, you can get those at Bed Bath & Beyond. That, for anybody that has a bad, that can't sleep well, or is a little congested, elevating the head really helps. GERD. Anybody that has GERD, they're probably not breathing well at night, so they probably need to learn how to breathe through their nose and open up their nose and do these exercises. But same thing, I like a pillow between my knees. I like 2 pillows to hug. It really raises the arm and it reduces tension in the neck. And you want to practice really the reduced breathing exercises right before bed. It would be really good for you to be able to, sorry, this is, I'm gonna keep going. It's a really good thing to notice how your mouth is closed and this one woman's mouth is open. The people that can really exercise with their mouth closed, like the Kenyans that win a lot of the marathons, those are the people that really use breathing properly, efficiently in their body. So all in all, what did we learn today? Our bodies adapt to how we position ourselves. And if you're someone that always is slouched or in a bad posture at work, you've got to stretch it out. You've got to kind of stretch it so it goes to neutral. Otherwise, you're going to be cramped up and tight because of what you do all day. So I've given you a few things to stretch here, and to make sure that your jaw is hanging, because it's a suspended bone, that it's hanging without any tension, right? We talked about some airway exercises. Why? Because our tongues support the back of our throat. Our tongues are meant to rest gently up, supporting the back of our throat. Those of you that are tongue-tied, those of you who have allergies, those of you that have a low tongue posture, they tend to have a lot of more tension around their neck and jaw. So restoring tongue posture, restoring tongue length of the frenulum will help support the airway. And We did some goalpecs. The goalpecs is all about oral posture, practicing good oral posture. How is your mouth supposed to be resting without tension? There's a way to do it. And, you know, relaxing the way our bodies are held is, you got to learn it. Sometimes we don't know. And these exercises are really simple. I would love for you to try it. If you have any questions this week, please feel free to reach out to me. Um, I think Christine sent out the email, and I will send out the notes on this, all the exercises on this, so that you have it for your review. But please feel free to email me back. Okay. Any questions right now before we end? Nope. Okay. All right. So we will see each other for the last neurological section next week, and look forward to it. Oh, do you have a question? Yep.
In our area, and I think this is quite common, we can't find people to do myofunctional therapy, and it's huge in orthodontics, and it causes a lot of problems with retention and in treatment. And apparently, it's the students are not being made aware. There's great growth opportunities, and it'll improve results if we could just find people who know how to do it and are willing to do it. It would improve orthodontics substantially.
Are you an orthodontist?
I'm a pediatric dentist, but I work with a ton of orthodontists, and I've been doing it for over 40 years, so I can see
Yeah.
how it influences treatment results and relapse, particularly.
You know, the great thing I will tell you, these are for people only in Illinois, is that my staff is all trained in it, and we, you know, it's an area that you can see very easily via telehealth, and it's covered by insurance because of COVID. You know, it's not something that, you know, I don't know how long it'll be, but I think COVID's going to be around for a while, and people aren't really coming in like they used to, and insurances are mandated to allow reimbursement. Now, because we're physical therapists that do head and neck, it's like going to PT for your shoulder or your knee.
Right.
It's PT, and the majority of people have medical coverage that does PT. So it's a low cost. I had a couple of people reach out to me, and I wondered if it was someone from the North Shore. Maybe I can look it up real quick. Someone reached out to me because there was a orthodontist that had recommended me, and I had not met him before. Is there a lot of orthodontists in this group that may have? I don't know. I'm not sure.
There should be. I mean, it just, the orthodontists just live with it. They just live with this as a potential for relapse and compromise of the treatment. Let the people know that in their informed consent, and then don't do anything about it. So it gets them off the hook.
Yeah,
but
it's
but
not.
it's compromised treatment. After, you know, an orthodontist is so popular. I mean, Align Technology, the stock is like 620. I mean, you can't believe how this has grown.
I agree, and listen, I get failed ortho cases all the time, and all I can tell you is our office, we have 5 therapists that do myo, and they're used to telehealth. And for kids, it's you know, I always like to get them in so I can really structurally understand and do an
Right.
evaluation. But after you get a good sense of them, they can do a lot of this once a week for a half an hour, teach them the exercises, and then they do it on their own. It's not perfect, but it's something. You know, kids need, and they also probably, some of them need frenectomies, and training them to get a frenectomy. I do not like when people get them and have had no tongue training. It's not smart. You're going to have a bad result when the, you know, if they're not guided with a myofunctional therapist along the way. People are so scared to move their tongue after frenectomies, but anytime there's an expansion case, they should do myo with the expansion. So I am a complete believer in what you're saying. And if you have any orthodontists that you think would be open, because some of them I've reached out to and they're not always open to myofunctional therapy. I don't know if you're aware of that too.
No, I'm definitely aware, but we've been looking to speech pathologists to help us, and I don't think it's emphasized in speech pathology.
No, it's just because their speech, you think that they, like my child did 2 years of speech and he was tongue-tied. And that was before I even knew anything, but I'm like, you go to a speech pathologist, you think they know about the tongue and tongue. Some do if they got training in it, but some don't. So
this is really a PT thing. Okay.
It's to me, listen, I'm going to send you some information around our myofunctional therapy program. And what is your full name? Because right now it says Paula Cantor.
Oh, no, that's my wife. It's Jeff Cantor, JEFF CANTOR.
Okay.
I mean, every ortho office should have someone trained in this or a referral system, and probably should not even start some of these cases until some of these habits are corrected.
So the Goalpecs program, that Simon Wong program, the dentist that's I think is from Melbourne, he won't put anything in their mouth for these expansion, mouth breathing, narrow cases until their mouths are closed. And the Goalpecs program is to close the mouth so that they can tolerate putting something in them. If you put something in a mouth that can't close, they'll just kind of be open more.
Exactly. No, I mean, this is so fundamental. It's just unbelievable to me that nobody has, within the profession, really, although I was told from a patient who had started ortho in Europe, that in Europe, they correct the tongue first. They correct That's the first thing.
And in Chile, where my mentor, Mariano Roccabato, I don't know if you know who he is, their program is the kids don't get ortho until the jaw is screened and make sure that there's no dysfunction in the jaw before they put all the braces on. Because if you put braces on and keep working in the mouth of a child that has a displaced disc, it's going to make it worse faster. So
I'm afraid a lot of this is driven by free enterprise. That the whole idea is to get the kid early, start the case early, finish the case as quickly as you can, as efficiently as possible, and just keep it going. Not necessarily get the best possible result.
I have one orthodontist that has converted into more of an airway person that understands the airway and the tongue, and she says it doesn't fit in the mold of the orthos. The orthos, it's like really fast paced. It's too complicated. It takes more time.
People don't want to pay for things that they have to do themselves. They want the orthodontist to move everything, and all they have to do is just stay alive for the 18 months to do it.
You know that the tongue and the teeth and the lips are their own braces if you function properly, if you swallow properly, if you rest properly, so you shouldn't need any of this stuff. But I think ortho is like, it's so.
I'll tell you, you could train people, have a telehealth training and the orthodontists who are really involved would have their people paid to have their people trained, and you could be you and your people could be the resource to call in on difficult cases. It would be amazing.
I agree.
Want better results.
Another thing I find that people, they don't want to pay, because a lot of times this field of myo has been more a field of dental hygienists in the beginning, and there's no dental hygienist codes that you can bill insurance and get reimbursed, so it's an extra additional cost for the patient, and because of that, people don't want to pay. You said it.
Right.
The nice thing about using a PT
Right.
is that
Exactly.
it's PT benefits, and it's legit. I mean, this is legit stuff. It's
Of course.
so. I mean, I think that you know what? I'm gonna find out. Give me your email, and I'm gonna find out who this orthodontist is. Because and Dr. Harvey, I'll send it to you too. I'm trying to figure out who found me, and I thought it was someone in this group. Dr. Cantor, what's your email?
JEFFREY.
Yep.
S as in Sam, CANTOR @gmail.com.
Okay.
I bet you I could get you 2 or 3 orthodontists who would be willing to
They just
train
need to,
their people.
they need to do this. This is like they're only doing it half if they're doing the, you know.
That's why even the best orthodontists have treatment failures.
Right.
I mean, the best technical people who move the teeth in the most efficient manner, they can't, because it's the, you know, there's so much more to the oral cavity than just teeth.
Right. Right.
Obviously.
But, you know, sometimes you would think that they would not stop until they found the right, you know, team. It takes a team approach, you know.
We can do it in cleft palate. It happens, it's been going on for years. There was an acknowledgement by the medical profession that they had to bring in dentists. And the dentists have to work with the ENT people, and they sort of figure it out. But in mainstream orthodontics, they're too independent. They're just relying on their own research, their own training, and they just don't want to get into it. Same with TMJ. If TMJ would be treated like any other joint, the physicians would be in this big time. Just like shoulders, knees, and hips. There's a lot of money in this, but somehow it's gotten neglected.
Yeah, the TM, you know, that's my bread and butter. That's what I'm known for in Chicago is restoring the TMJ, and you can't just throw a splint in. You can't. I always try to get my dentist to let me work with the patient for a month. Just give me 1 month. They're going to need a splint, but let me get their head in the position where their jaw's forward a little bit, not here, and then have them clench on the splint protecting teeth. The point of the splint is to create a little vertical height so that they can decompress a little bit. Otherwise, when their head's forward and they put the splint in, they want to clench on the splint even more. It's not, it is not the right sequence of treatment. Like I am someone that just, our team, and we're actually, Dr. Harvey, we're looking at spaces in the North Shore to open up an office. And I'm, if you all have any,
good idea.
Well, I'm just saying, like, if there's any space that you know about that's available, even to start something smaller and grow, I'm looking for that right now with my partner. And I just feel like the dentists don't understand the effect of the neck with the jaw, you know. I told you a little bit that if you have a rotation of the first vertebra, it can't steer mandible. So if you start filing down teeth because something's hitting hard on one side because it's canted, you've just kept their neck in, you've stuck their neck in a position that won't move, right? So you want to balance. You want the atlas to be even. You want no rotation. You want the space between the skull and the first and second vertebra and the third vertebra to have this space so that lordosis is possible. So the back of the head and the front of the face can find a resting tone. And, you know,
You'll do fine. Blue Pearl Animal Hospital is in Glencoe on the North Shore. They're a high-end animal hospital that treats every conceivable type of animal and does any conceivable treatment on dogs or cats, from oncology, ophthalmology, psychiatry, nephrology, everything. And they're doing just fine. So with no insurance, no insurance, right? So if Blue Pearl Animal Hospital can do it, you guys who are dealing with actually human beings should be able to establish some kind of following,
Yeah.
especially if insurance is going to pay for it.
Right. Right. Yeah. So yeah.
Do it while you've got the energy for this kind of a project, because dentistry, it's just we've gotten ourselves in a box, and it isn't good. And this is a way to also to rebel against the corporatization of dentistry too, because they're trying to commoditize it and they're very successful. There's the dentists will stand out who have a more physiological understanding of this, especially in orthodontics, will be able to differentiate themselves from all these cookie cutter practices that are going to be developed because dentistry is ripe for corporatization.
Yeah.
It's happening right now.
Yep.
Yeah.
Yeah. I'm. Is there a Dr. Robbins up near you?
Yeah. Yes.
I finally met him. I heard very good things about him. And I told him about the breathing training that I do and the myofunctional. And he's like, we don't really use that. And I'm like, and he's been around for a long time.
Oh, yes, he's been around.
So we're actually working on a case together, but I'm trying to open his mind up to, that the rest of the body does connect to this jaw. And
You'll probably have more success with younger people.
I agree.
In general, in general, there are some older people who are open to it, but I think younger orthodontists who are probably more computer savvy and sort of get the bigger picture might be more open to it.
Yeah. Yeah.
Right. Yeah, you're on the right track.
Thank you, Dr. Cantor. It's been a pleasure. You've been great to talk to. I could talk to you forever. I think.
Oh, yeah.
So,
well, we'll be in touch.
yes, I appreciate it. All right. Thank you so much, Dr. Harvey. And listen, I'll see you guys next week, same time. Okay.
Okay.
Bye-bye.
Bye-bye.
Thank you so much.